Hello, I'm Dr. Seisha Blazer, back again with Dr. Ray Pierzolo, and if you may or may not have known, we are married, and we're here with our kids to talk to you a little bit about pediatric eye exams. We very commonly get the questions from parents, teachers, patients, when should I be taking my kid in for an eye exam? And so we're going to talk about a little bit about that, and when the American Optometric Association does recommend that kids get an eye exam, they do recommend the first eye exam happens between 6 months and a year old. Now you may wonder, well, what can they really do during an eye exam at that age? And there's a lot that we can evaluate. Now at that, again, we're not necessarily testing for fine visual acuity, but we are checking on the way the eyes are working together as a team, making sure there's not huge refractive errors, and obviously making sure things are healthy.
So today I am going to demonstrate how you do a pediatric eye exam with our two visitors here. Say hi, guys.
Hi. Hi.
And
So Aubriana is 4 and Braden is
2.
So we're going to show you what that looks like and how that process will happen so that you have a better idea of what goes on during a pediatric eye exam. So when we have a kid in the exam room and they come in with their parents, first thing I'll do is I'll try to talk to the child a little bit and get a good feel for how they are, what their personality is. So usually I'll have the kid come right over here, have them climb up into the chair. If they can sit there by themselves, that's what I like. And you know, the kid will be here with me, and mom and the rest of the family will be sitting over in the chair on the side, and we get to work. So the first thing that we try to do, like I said, is try to get a gauge on the child's personality, and you talk to them a little bit, and you'll ask parents if they can do their letters or identify shapes and things like that, so that I can get an idea of if I can check their actual vision and see the way that they see without having to rely completely on myself. So first thing I'll do is I'll check and see if they can read their letters. If they can, that's great. It gives me an idea if they're 20/20, 20/40, 20/60, 20/80. With children, especially under the age of 6, you can't always rely on what they tell you. Sometimes they get very shy when, sit down. Sometimes they get very shy when the letters get too small. So you have to rely again at being confident in your findings and what you see when you're examining the kid. So my most important piece of equipment is this. This is called a retinoscope. A retinoscope is a light. When I shine this light into the patient's eye, I can find out if they have a prescription, whether they can speak or not. So I would take this, hold it right up to their eye, shine it in here, and that's where I take this tool. This is called a lens rack. And I hold the lens rack in front of their eye. I have the child look at me, kiddo. Look right at me. Look at me, look at me, look at me. And I shine the light in their eye until the light bounces back at me a very certain way. If the light reflects at me one way, I know I need to add certain lenses. And if the light reflects back at me another way, I know I need to put other lenses in front also. We do that on one eye, and then we do it again on the next eye. Look at me. Look at me. You're doing a good job, kiddo. Good. Okay. Now, after we have some of those things done, we also check to see if their eyes are moving appropriately. We can use anything from a pen to a Q-tip to any special device that we have or anything that we think the child will look at. So, look right here. Look right at the Q-tip, kiddo. Follow it to your nose. One more time. Follow it all the way in. Look right at it. Look right at the Q-tip. Follow, 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 follow. Okay, good. And we'll also...
Daddy, when things go close to my eyes, it makes my eyes, it makes my eyes feel kind of dripping.
Kind of dripping? Okay. So sometimes kids will tell you those things. We have to decipher if that's actually a visual problem or if that's something that you that you need to look more into. We can also check and make sure that their eyes are moving properly. Look right at the tip. Follow it. Good. Follow, follow, follow. Follow. Look at it. Look right here, kiddo. Look up here. Good. Look down here. Good. Look over here. Look down here. Okay. And then, importantly, with kids, we want to check and make sure that their eye health is okay. That's where we go to one of these last pieces of equipment here. This is called an ophthalmoscope. We take a look at the back of the child's eye when we're looking in there with this. We hold it right up and we hold it real close and we get all the way in there. And we take a look and we make sure that everything looks healthy in the back of the eye. Once we've determined that the child has no real prescription and that everything looks healthy, those are the main things that you're looking for in children. Whether their eyes are healthy and if they really need any strong pairs of glasses. Now, at 4 years old, you can do a lot more than you can with somebody who's 2 years old. But you do want to try to keep the same basics in that age group.
So thanks for tuning in. We are trying to give some more information. They are not here on our South Shore Eyecare YouTube video channel. We just want to get the message across that kids getting an eye exam is very important. We can start at 6 months to a year old. And we do recommend then be around 3 and 5, and then every year, once they're starting kindergarten, to make sure those eyes are working appropriately. Sometimes things can be caught at the pediatrician's office or during those school screenings, but not all the time. And there's a lot of things that we evaluate here in the exam room that are not necessarily caught because, again, remember, kids aren't necessarily knowing what is normal versus not normal. So we want to make sure every kid is set up for success in school by making sure their eyes are working well. And that can start at as young as 6 months to a year and throughout their entire life. So thanks again. Have a great day. Say bye.
Bye.
Go say goodbye. Go say goodbye. Go into the thing. Say goodbye to the screen.
Goodbye, screen.
Say bye.
Goodbye, screen.